So there's a quarter on your desk. Please leave that there for the remainder of my speech. If by the end of my speech I've convinced you to donate to my cause, I'll pass around that boot and we can help kick cancer to the curb. Cancer is a general name for over 100 diseases. The magazine of Cancer Facts and Figures says that there are 1,665,540 new diagnoses of cancer each year, taking the lives of 585,720 individuals. That's 1 in 4 deaths, making cancer the second most common cause of death in the United States. It's also most often hereditary. I have a very lengthy family cancer history, and I do some work with the American Cancer Society, so I thought that's what I would talk about today. When this class took my Black Boy survey, 90% of the people in this room said that they had had a loved one, or at least 2 loved ones in their life, battle cancer. But only 45% of those people know anything about cancer research or who the American Cancer Society is. So today I'll talk about how cancer develops and its inheritance, the risks that you should keep in mind, prevention methods that you should use, and treatment options that are available if cancer does occur, and what the American Cancer Society is, what they do, how they help, and how we can help them. So, what is cancer? Although there are so many types, all cancers begin with an abnormal cell growth and growing out of control. Family cancer syndrome is what the medical industry calls inherited cancer, according to the American Cancer Society. Cancers that tend to run in the family are technically inherited gene mutations. And what an inherited gene mutation is, it occurs in either the sperm or egg that conceive a child. All cells come from are carbon copies of the very first cell that makes up an individual. So, if that first cell has a gene mutation, every cell after that will as well. And that's how those mutations are passed down from generation to generation. So, how does this killer work and who is affected? Well, to every person, it has 2 copies of each set of genes from their parents. If someone inherits a mutated copy of that gene, they already start out with 1 mutation. So if the other copy fails at some point, then the entire gene is compromised. If that is a cancer-susceptible gene, then that's what causes cancer. Cancer-susceptible genes come from tumor-suppressive genes. Tumor-suppressive genes, or TSGs, are what slow down the division of cells, repair DNA, and tell cells when to die. So if a TSG stops working, cells start to grow out of control, and that's what a tumor is. That's what causes cancer. Family cancer syndrome comes from an inherited defective TSG. So like I said earlier, there are over 100 types of cancer, but according to Corey Ellis, who wrote Cancer by Numbers, there's a top 10 list of cancers that people are susceptible to, starting with skin cancer, lung cancer, prostate cancer, breast cancer, colon cancer, kidney cancer, bladder cancer, non-Hodgkin's lymphoma, thyroid cancer, and endometrial cancer. Genetic specialists say that 2 to 3 diagnoses of cancer are from inherited gene mutations. So, know your risks. Know what kind of cancer runs in your family, if there's a gender trend, if it was an age trend, things like that. Also, be preventative. Environmental and occupational decisions can affect that. Brett Israel is an author for Scientific America, and he wrote an article about how cancer is linked to environmental and occupational choices and the chemicals and things that you're exposed to. Don't use tobacco, maintain a healthy weight, cancer likes to feed off of fat cells in the body, and see your doctor regularly, because if there is something to detect by seeing your physician regularly, you will find that early, hopefully. And if you do find something, the Mayo Clinic suggests that the most effective forms of treatment are surgery, chemotherapy, or radiation therapy. So, cancer is very scary. Luckily, the American Cancer Society is here to help. They are a nationwide, community-based volunteer health organization that is dedicated to the elimination of cancer and saving lives. On a global front, the American Cancer Society holds support groups online, and they also provide information and research to the medical industry each and every day. Locally, they can help transport patients to and from treatment, host support groups, and also host a lot of fundraisers which help raise money to find a cure. The American Cancer Society is dedicated to funding the best science. 19% of their total dollars raised each year goes to external research projects, and the rest goes to vital patient care. But the Society receives 2,000 applications for external research projects every year and is only able to fund 260 of those projects, and that's where we can help. As Ball State students, we are required to take a CompQ 10 class, and at the front of the class, every lesson, there is a red bucket where you can place money into. So, please, when you're in that classroom, place $1 in the bucket, because in 3 weeks, I will be participating in the bucket speech, where I will present this speech to a panel of judges in hopes that they also agree that the money in that bucket will best benefit cancer patients everywhere. I've now talked to you about how cancer disease develops and how it's inherited, how to prevent cancer and treatment options that are available, and how to know your risks, and what the American Cancer Society does and how we can help them. So at the end of my speech, if I have now convinced you to donate to this cause, I will bring around this boot so we can help kick cancer to the curb, and place your quarter in the boot, and I will, every quarter you place in the bucket, I will treat as $1 match towards it donating directly to the American Cancer Society, not the bucket, but directly to the society themselves. So, help fund the cure. For you, for your family, for your friends,